We're going to go ahead and jump into this discussion with introductions. I'd first like to start by inviting Ms. Gabrielle Perry, founder and executive director of the Thurman Perry Foundation, to kick us off with our panelist introductions today.
Hey, y'all. My name is Gabrielle Perry. I am founder and executive director of the Thurman Perry Foundation. We are a Louisiana-based nonprofit, but we do operate nationally, and we serve women and girls impacted by incarceration. We have a 3-tier program at my organization, but the crux of my organization, the bread and butter, and the issue that honestly surprises the most people is addressed through our Girl Code initiative. So every single month, we donate organic menstrual products to incarcerated women in prisons and jails, as well as women and girls who are in transitional housing and juvenile facilities in about 5 different states right now. It's good work and it's necessary work given the state of menstrual equity for incarcerated women. And to date, as of this month, we've donated a little over 200,000 organic menstrual products in 2 years.
Amazing. Reagan, did you want to go ahead and introduce yourself?
Sure. Hi, everyone. I'm Reagan Moss. I'm also on the Youth Advisory Council and Board of Directors at Period. And prior to my present position at Period, I founded a chapter in East Alabama where I attended undergrad. And during my time in undergrad, conducted a study exploring how people were experiencing period poverty in correctional facilities. We were really wanting to understand why there were discrepancies between what was in handbooks and state policy with the reality that women and girls were experiencing, particularly within prisons.
Awesome. And then I'll kick it off to Serena.
Thanks, Asia. Thanks for having me. I'm Serena Martin-Lagori, the executive director of New Hour here in New York. And I am a formerly incarcerated Latina who founded New Hour really to figure out ways to support all of us, especially women and girls coming home from incarceration. So proud to be here, honored to be with you all, and excited to get into it.
Awesome. Thank you all so much for introducing yourselves. I'm super excited to be amongst you all and to get into this very necessary conversation that is so often overlooked in the menstrual equity space. So just for context, the United States has the highest incarceration rate of any country in the world, with nearly 2 million folks behind bars. And people who identify as women are the fastest growing group of incarcerated people in the US. Despite this historic rise, correctional facilities have often failed to consider unique needs of menstruating folks while incarcerated. And so I want us to get into talking about managing a period while incarcerated. But to start, I'm really glad that you all are joining us on this panel, and I would love to hear from you all about what kind of led you to this work of advocating for incarcerated women in general.
I'll go. So I am 30 years old, but incarceration has kind of shaped my entire life, the entire trajectory of my life. My birth mother actually gave me away to strangers on the day that I was born, as she had a pending jail sentence and was trying to essentially save me from the life that she had found herself in, the circumstance she had found herself in. And yet she couldn't. I ended up being arrested about a week after my 21st birthday, stealing money and food, trying to survive. And so that entire experience, not really the incarceration itself, I was not incarcerated for very long, thanks to Article 893 laws, which in Louisiana are a series of very hard fought laws that try to curb prison overcrowding and essentially keep non-violent felony offenders out of jail. So I was spared and I was given a second chance, both by that and the judge on my case, who saw that my crime was a crime of survival and said that he was not going to throw away my life because of that. And so in the years that followed, I went back to school after beating homelessness and hunger, but I just felt a ton of survivor's guilt because I distinctly remember the women that I was incarcerated with being very, very kind to me, very, very kind. Sharing food, sharing resources. You don't get a ton of things while you're incarcerated. And I felt a ton of survivor's guilt after finishing school and getting my life together. And so we started my organization in memory of the father who saved my life, but also the women that I left behind, because I mean, there, but for the grace of God, go I. So that's kind of how I got into this work.
I can share a little bit because Gabrielle's story touches me because I spent my 21st birthday in prison and survived family trauma and had, again, a mother with mental health issues that led me to become incarcerated as a result of a family tragedy. And as a Latina, what I found when I entered the New York State prison was an overwhelming amount of Black and Brown sisters who were kind to me, who showed me how to do my bid, who walked along with me in my pain for those 3 years. And I was lucky enough, I had an aunt and an uncle and a dad who would send me packages into the prison when I could get them. I could never afford tampons, even with their support. So when you go to commissary to buy supplies for the week, you buy food so you can cook something healthy because the food isn't healthy. And the cost of tampons was exorbitant. I never, in the 3 years I was there, ever bought a tampon and didn't have that luxury. And so what we see all these years later, I was incarcerated 20 years ago, that inequity is still very much the case.
Thank you both for sharing. I haven't personally been impacted by incarceration, so my interest in reproductive health in facilities came out of stories when we were donating period products to people in reentry and transitional housing, and understanding that inability to access period products began long before their experiences in reentry and transitional housing. We were donating to those organizations because even for nonprofits, these products were really expensive, especially small nonprofits, providing so many different resources. And outside of that, I was working with the Alabama Prison Arts and Education Project and being able to speak to colleagues and friends. We knew that there were still issues with access in the facilities. And then there were investigations by the Department of Justice that also highlighted the lack of access.
Wow. Well, I would first like to say thank you all for just coming into this space, being so vulnerable and sharing your stories and sharing the work that you all do. I'm already feeling inspired, and we haven't even really gotten into the conversation yet, so I'm excited. So I first want us to kind of lay the groundwork and talk about what period poverty is. So in you all's own words, anybody can jump in and answer. Can you define period poverty and what that means in your own words? And why do you think that incarcerated women and menstruators are often excluded or overlooked in the movement against period poverty?
I'll go. I would like to define period poverty in the lens of incarcerated women. So period poverty for incarcerated women is the inability to access or afford menstrual products during their period of their incarceration. And that logistically can look a lot of different ways. We actually, when we were doing the research, we ended up coining the phrase menstrual mitigation measures, which I felt like, because there's so much ignorance around the topic, that there needs to be a phrase that can kind of succinctly sum up the human rights crisis that these women are facing, because this is a biological need that these women are having that is not being met. And it has steep consequences. Period poverty for incarcerated women has steep consequences. You're talking about women who are using socks. They are using old cut up clothes. They are using mattress stuffing. They're using what little menstrual products they do get, if they are allowed to have them, past the point of them being viable. And this is already studied and leading to an increase in reproductive infections. I had one of my former board members who was incarcerated in North Carolina ended up having an emergency hysterectomy due to using a menstrual product at least for 2 weeks, just trying to menstruate with some kind of dignity. And I think that often incarcerated women are excluded from this narrative because there is no narrative around women who are incarcerated. People do not think about women when they think about incarceration. The face of incarceration in the United States is a male face because it's easy to put a boogeyman narrative on a man. Nobody wants to talk about the fact that women who are incarcerated are 75% mothers of very young children, who almost all of them come from impoverished backgrounds. Over the vast majority are there for nonviolent crimes, many crimes of survival, just like mine was. And because we don't think of that, if we even do let our minds wander to that direction, then it becomes, okay, well, the state, our taxes give them everything that they need. And that is not true either. That is not at all true. If you live in a state that does mandate that women be given products, it's not just about the products that they're given, but the type of products and the products in enough supply, how the distribution happens. All of these different things contribute to period poverty for incarcerated women.
And just to add to what Gabrielle is saying, the system of oppression that is prisons and jails is very much focused on subjugating women. And the oppression of the patriarchy is played out in the criminalization of Black and brown women. And one of the ways that we see that inhumanity happening inside of prisons is the level of abuse of power that often correctional officers will use to withhold sanitary pads, will ensure that, you know, that women I have seen not get the basic human rights that they deserve, the basic access to menstrual products, simply because of the retaliation of officers who want to dehumanize and take away the dignity of those of us who are incarcerated. And you know what Gabrielle said is so true. 75% of our women behind bars are mothers, but an overwhelming 9 out of 10 of us have survived abuse. And so going into prison, you know, my self-esteem was already completely shattered. Add to that, having to go up to an officer's booth and say, can I have some sanitary napkins? Can I get more? And to have to deal with that kind of confrontation is not something that most women are willing to take. And so the system is set up to really subjugate women and further humiliate women behind bars.
Yeah, the only thing I'll add, you both answer that really eloquently. I think when we were interviewing people talking about their experiences, one of the things that really stood out to me is largely when we define period poverty, we look at material that people are able to access and barriers to that. And this study really emphasized over and over that also having safety and privacy and how you access and manage contributes to experiences of period poverty. And just to build off of what you said, Serena, all of the participants in our study highlighted that having to ask a male officer for period products was really degrading. And for a lot of them, it did parallel the experiences that they had with abuse prior to being incarcerated and was really dehumanizing.
Thank you all so much for your answers. You all have kind of touched on it already, but is there anything you can add or speak to about some of the general limitations or security regulations or policies that are impacting, you know, people with periods while they're incarcerated? For example, it might be a policy or, you know, limited access to healthcare or shower or laundry limitations. I just want us to kind of speak to that as well.
I can say I would love Serena to mention it from like the day-to-day lens, because I was not incarcerated long enough for this to be an issue for me, in addition to other like health issues where sometimes I don't menstruate. But I can say from the donation lens, we have become incredibly versed in just the variety of different things that these women are experiencing in the quest towards accessing products. So when we donate products to prisons, to jails and whatnot, and it's important to denote that prisons are not jails. These are two different things. And a lot of people use them synonymously, but no, in the donation process that we do, that's really where you find a lot of the variations. What you'll find, what we have found, especially in our first facility we ever donated to, tampons are considered a security risk at certain facilities, and that's not uncommon. And a security risk can mean anything. You have to get very creative when you're behind bars because you are not given very, very basic things, cleaning supplies, things of that nature. So the women will sometimes use their applicators to help clean themselves, or use tampons for different things. And so the prisons don't like to distribute them. And so we only donate pads because of that. Then you'll find that, they don't want ones that are wrapped a certain way, certain kinds of packaging. There's a very, very lengthy process that we go through with these facilities that we often try to anticipate to ensure that these women have what they need. So we typically go for individually wrapped pads as the most efficient way to donate. We also maintain a heavy sense of communication with these women so that I know, and my team will always know, that they are getting our products. And I think that the consequences of that, policy-wise, range from facility to facility. What you'll find is that, okay, for certain women we've encountered, where, depending on where they're incarcerated, if they are trying to honestly just opt out of this inhumane process entirely, if they decide they want to free bleed, that can end up with you having time added onto your sentence, because you are soiling your prison issue clothes, you're destroying prison property. So that can end up with you having time added onto your sentence. If you cut up or rip your clothes and whatnot in order to try to use that as a makeshift tampon to try to, the ingenuity needed to survive, that can also add time onto your sentence and can also be seen as you destroying prison property. There's a different set of rules, a different ecosystem when you're behind bars. And so the policies reflect that, but most people don't know that.
Yeah, and I definitely remember women getting tickets for destruction of state property because they were trying to make sure that they were properly clothed. I'm so grateful, first of all, for Thurman Perry Foundation and for donating so many menstrual products to our women in our state prisons here in New York. And I think that we need to move beyond the conversation that typically happens with men in power, where, 10 years ago, they said, well, we don't want to talk about that. That's not our issue. And very recently, and I actually saw the acting DOCCS commissioner today, and mentioned you, Gabrielle, mentioned our work, and he had said, thank you for the donation, because what we often find is that if you ask the powers who are in charge what they're doing, the answer is always yes, we're supplying everything that every woman needs. But the truth is that if you need to have access to a shower, access to the bathroom during count, during lock, you don't get that access. If you need, additional support, especially with issues related to reproductive health issues, the wait time for reproductive health to see an OBGYN and a doctor is often very long. And that isn't even including the fact that unfortunately and horrifically, many of the practitioners who practiced GYN and OBGYN work in prisons abuse and harm women. I'm one of those women myself. Who was harmed by an OBGYN practitioner. So when we think about what happens to women behind bars, this is an added layer of vulnerability that this system is not protecting the humanity of women behind bars. And it's something that we often see is used against women consistently, because it's another way to create a ticket, which is maybe you're put in solitary confinement, maybe you have the rights to get packages taken away from you. Destruction of state property is a serious ticket. There's tier 1, tier 2, tier 3 in New York. And this could mean even additional time onto your sentence at some point if it's very serious. So it is oppression within oppression. is really what happens within facilities. And most of the facilities are focused on men and the issues of men, and nobody talks about what about her? What about the women behind bars, the mothers and sisters and aunts? So this is such a meaningful conversation, and one that I think we should be having as often as we can.
Yeah, thank you both so much. That was really, really insightful. Gabrielle, you kind of brought up the term earlier, but menstrual mitigation measures is a term that you published and coined, and it refers to any action that a menstruating person performs in order to manage the flow of their menstrual cycle, control their menstrual hygiene, and otherwise maintain their dignity, especially in periods of socioeconomic scarcity, houselessness, homelessness, and/or incarceration. So can you speak more about why you published and coined this term?
You're muted. Gabrielle, you're muted. Sorry. Sorry. Thank y'all. I saw the chat. It was really important for me to help establish a conversation because, like I mentioned before, there is no conversation about system impacted women. 1 in 3 Americans has a criminal record. That's not counting people who are in juvenile facilities. That's not counting people who are in ICE detention. That is not counting people who are in military prisons, tribal prisons. It's an epidemic. And it's not one that's talked about because it's considered a moral failing as opposed to a systemic issue. And so because I wanted to start a conversation, I knew that I would have to be the one to start it. So I went to the Washington Post and I told them that I wanted to write this article about periods in prison. And the first time that phrase saw the light of day was in the Washington Post. And so it was important to me to be able to contribute something to the field, both as a formerly incarcerated woman and as an epidemiologist. It's my duty as a healthcare provider to name and claim these issues so that they can be sorted. You can't fix a problem that you don't know is there. And so I also felt like I had a duty to my birth mother because the reproductive health is wrapped up in so many things, but it's people don't realize that things happen to incarcerated women before they ever happen to women in the general public. Abortions happen behind bars. Reproductive health care happens behind bars. It's just not quality healthcare. My birth mother was actually incarcerated for a very long time, and over years while she was incarcerated complained of abdominal pain, complained of cramping and whatnot, and was told by healthcare providers at the prison system in 2 different states, in fact, Texas and Florida, that she was just having menstrual cramps. You know, I think the strongest painkillers you get while you're incarcerated is about Tylenol, extra strength. And then ended up being rushed to the hospital with what was stage 4 metastatic colon cancer, to which she died a year later of. And so this is a healthcare and a human rights issue. And you cannot address these things without there being a issue to address, something, a tool in your arsenal, something to teach and educate people that, hey, this is happening. So that's what led me to that.
Well, thank you so much. I definitely agree. I feel like having the language to describe something and to describe, the experiences of individuals is really important. So thank you so much. Serena, if you're comfortable in doing so, can you describe the ways that you witnessed women, trying to menstruate with dignity, while they were incarcerated?
Yes, one of the things that happens behind bars is you're required to go to program. You're required to work. You are not paid a living wage. There's an exception to the 13th Amendment, which forbids slavery. That exception is incarcerated people. And so you have to go to your job, whatever that job is, whether you're sick or not. If you have serious cramps, if you have reproductive health issues, you still have to go to your job. If you don't, you're locked in your cell and you're punished. And so the sort of perpetual punishment that happens to women behind bars because of the lack of menstrual equity is palpable. you know, what Gabrielle said reminds me of a woman I knew. Her name was Val Gator. And Val was an amazing woman. She had been in prison since she was 16, 17 years old. And she spent many, many years there. Never came home because not only did they, you know, kind of fluff off her stomach pain, but by the time they did get to it, it was so bad that she had stage 4 cancer. So it's almost the identical story that we're hearing over and over. One of the other major issues that we see behind bars is a lack of support for new mothers, mothers behind bars with infants, mothers behind bars who would like to nurse, breastfeed, have breast pumps. There's such a lack of equity, and it's, you know, every prison and jail is its own little fiefdom. However, the sheriff or the docs commissioner or whoever the superintendent is, the warden, how they want to run it in that facility is completely up to them. And so the disparities are huge. Out here, you know, where I am on Long Island, although I'm in Brooklyn right now, but on Long Island, we have a Nassau jail that will not allow newborns to stay with their mother if they are born in the jail. Just 15 minutes away, if you give birth in the Suffolk jail, you can keep your newborn up to a year. If you give birth in the state facility, you can keep your infant up to 19 months and have access to a nursery. So the disparities are huge. And I've often spoken with many women who've come back after giving birth and haven't been able to get enough sanitary napkins to handle all of the changes that they're going through after birth. We continue to see that it's a crisis. And very recently, I spoke with a reporter who did a study on the access to tampons and sanitary napkins at Rikers Island at Rosie's, which is the facility that holds women in New York City. Rikers, as we know, is riddled with issues. And the Department of Corrections said, oh yes, we gave out hundreds and hundreds of tampons. When we took a look at the time frame that they gave out the tampons, they stated that 2 weeks in a period of 2 weeks prior to making that statement, when they should have been doing it for years. And when we look at the number of women that should have had access to this, it should have been 10,000 tampons, not 600. So there is still, if we don't hold the system accountable, they will continue to do what they always do, which is subjugate women, which is make sure that women are treated the worst. And I say this all the time as someone who talks about women's rights in our general community. The folks behind bars who are women are literally, we are the folks that people think of very last. Even, you know, incarcerated men come first. And when I've talked to my incarcerated brothers, formerly incarcerated brothers, they have said to me, we need more voices. We need more people to step forward. And I often say, we need men to be upstanders and to make a statement in support of period equity as well. Because no longer should this be an issue that falls to just women and feminists and people who care about women's issues and our sort of underground support that we offer each other as a sisterhood. This should be a communal and broad network of support for an issue that impacts everyone. Because listen, we've given birth to the world, right? Like, women are literally the folks who keep us alive. And so how are we subjugating women behind bars in this way? It is deplorable, and it really is something that it doesn't have to be that way. It really can be changed.
Thank you so much, Serena, for once again being vulnerable and speaking to that experience. I'd like us to briefly talk about the actual period products that are distributed and found in correctional facilities. Gabrielle, can you briefly touch on that and just describe the distribution process or access to period products behind bars and the different types of products that are actually available to incarcerated women and girls?
So because there's a general ignorance surrounding how things work behind bars, people assume that the state handles everything. But Similar to how a lot of our education system works, the state contracts private vendors, and they want things made as cheaply as possible, like just cheap, 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 cheap. What you'll see a lot in some facilities is the period products that are available don't resemble what you'd see at like the store at a Target or something like that. I mean, I've seen menstrual products given out by the state that I have only ever seen in like pictures from like my mama's time growing up. My mother is 73 years old. Or in developing countries. So they'll be coming apart they're barely cotton. Like a lot of them feel like almost like polyester, with cardboard applicators. I mean, it's just really sad. It really is sad. And it's also not healthy for the body. The average menstruating woman is going to use anywhere from 12,000 to 16,000 menstrual products over the course of her life. And that's such an important figure to know, because if you're incarcerated, every year you're incarcerated takes 2 years off of your life. And add into that the lack of health care. Typically, you'll see somebody upon intake to ensure that you're okay. And then you might see someone again in 5 years, depending on your stay. And that's typically the range that it goes, verified by the Marshall Project. And that's unacceptable, especially because the average woman who's incarcerated is between like 30 and 34 years old. So these are her prime birth giving years. These are her prime family planning years and whatnot. And it's unacceptable. In terms of distribution, the logistics of these things, it's not even that, because oftentimes the departments of correction will try to shield themselves from accountability by saying our state has a law that says that we do provide these to women. That may be true, but it is the distribution process that leaves a lot to be desired. For example, at one of the facilities that we partner with, we are told by the women and by women who are currently housed there and by women who have come out that they get 2 tampons at the top of the month for their periods, and then that's it. And you don't get anything else, and you have to go ask for those. And so when you are asking, not even just the lack of products in enough supply, because my organization donates about 21 products per woman at every facility that we operate within. Not just having to ask, but who you have to ask. The majority of correctional staff are men. Who you have to ask can put your very life in danger. The ACLU has sued numerous states. There's currently a massive lawsuit going on in New Jersey at the Edna Mahan facility, a class action lawsuit, because correctional officers were forcing women into sexual assault in exchange for menstrual products. And so it's such an indignity. It is such a crisis, and it is so ignored because we view crime and breaking the law, which I believe are two different things, word to Angela Davis. We view these things as moral depravity. Therefore, the consequences from it can only be something that you have reaped upon yourself. Thus, anything that happens to you because of it is something that you have reaped upon yourself. Therefore, it's hard to find people to support what is happening or to care when we talk about it.
Wow, thank you so much. I want us to transition into discussing policies and menstrual equity in U.S. correctional facilities, and anyone feel free to jump in and answer. Can anyone speak to, some of the work that's being done to address menstrual equity for incarcerated menstruators at the federal or the state level?
I can jump in to say that in New York, we introduced a bill last session. We're going to be pushing for it this coming session, which would really create standard human rights for infants and mothers behind bars. And that includes reproductive health access to doulas. In New York State, we just passed a bill that has support for doulas in the community, but this doesn't relate to women and mothers behind bars. One of the things that I worked on years ago was the anti-shackling bill, which banned the shackling of women during labor. But believe it or not, you still, just recently, we were able to pass a bill to allow a mother to give birth in the jails, in the prisons, with a support person there. Because before that, it was just you and an officer shackled to a bed giving birth. And the horrificness of this is that we still see that there is just not enough support and education and equity behind bars for women who are experiencing all kinds of reproductive health issues. You know, as someone who myself had, you know, I had my son, he's now 12, but I had him and had preeclampsia. And I ended up like, if that had happened to me behind bars, I would definitely be dead. The level of health care that's given behind bars is so subpar. And Gabrielle talked about it. You know, 5 years goes by before you ever see another OBGYN. I never saw an OBGYN again. I saw one in the beginning and was harmed by them, and then never saw one again for 3 years. And just to speak to the quality of tampons and pads behind bars, I never saw a tampon because I couldn't afford to buy one, and they did not give them out when I was there. The sanitary pads were the oldest sanitary I have never seen, you know, those very thick, you know, like I've never seen a pad, and they don't absorb and they don't hold. I mean, they're so outdated. And to me, it feels like almost like a purposeful continued punishment. You're doing your time. You're taking accountability for your crime or for your action or for even being a survivor of abuse, which you know, you maybe should not be here. And yet there's a continued perpetual punishment undercurrent that happens just because we are menstruators. And so, you know, I would love to see more work at the federal level on this for sure.
I'd love to piggyback off that just a little bit, because there's so much that can be said in that regard. I think that, like, if anyone's wondering like why both Serena and I or Reagan would kind of talk about like how these different reproductive health issues, aside from just period poverty, are being addressed legislatively, and it's because they have to be. They have to put as much into these bills as they can. For example, the most recent legislation that I can think of that was universally celebrated was the First Step Act in 2018 during the Trump administration, which made it federal law that women who are in federal prison have to be given menstrual products. They also are banned from being shackled while giving birth, and many other things that were put into that bill. However, where it misses the mark and why it's called the First Step Act is because the majority of women who are incarcerated are not in federal prison. They are in local jails and state prisons. That is where the majority of women are housed. And what you'll find is that it's always so close but so far in terms of things that are being addressed. What I am so proud to be able to say is that both the Thurman Perry Foundation and Period were endorsers of Congresswoman Grace Ming's Menstrual Equity for All Act, which she has been trying to get passed for a good bit now. And so when it does, it will ensure that menstrual products are given to women and girls at the school level, K-12 schools, colleges, homeless shelters, but also those housed in local and state prisons. And so we're super happy to be able to be a part of that. But there really is so much work left to be done in terms of how women access these things. And I think that there's just so much variation between facilities. People think that it's a public or a private jail issue or private prison issue, and it's not. Especially given how, like, for example, where I'm in Louisiana, our next door neighbor is Texas. So in Louisiana, I think women are paid anywhere from 4 cents to 40 cents an hour for work that they do. The highest paying jobs tend to be $1 an hour, but they reserve those for the men because the gender pay gap does exist. While you are behind bars, the best jobs are typically given to the men and reserved for the men. Whereas in Texas, which the Eighth Amendment was based off of their cruelty and how they treat people, you don't get paid anything. You work sun up, sundown until your sentence is over with, or unless you have a verified medical condition. And when it comes to speaking about the medical condition part, people also don't realize that healthcare providers that you see while you're incarcerated are not necessarily doctors. They are not necessarily certified people. In the state of Louisiana, 10 out of the 12 contracted healthcare providers are not licensed physicians, or they have had their licenses sanctioned. And it's been for a number of things. One of them was convicted of possession of child pornography. Another one was running drugs through the prisons. Like, these people, because the Department of Corrections nationally has a clause that says that people, pharmacists as well as doctors and healthcare providers and whatnot, who have been sanctioned in the general public, can go and work in the prison system. You are just putting unqualified people, or at worst predators, in the same place as the women that we have housed in these prisons and jails in this country. So it's an entire infrastructure of harm being done to these women.
And I'll add, so within the state where we conducted the study, within the handbook, it says that necessary toilet articles will be supplied for you, or you can purchase them. They will be unlimited, continuously stocked, and if you're running low, just to ask a staff member. None of that was actually happening, despite the fact that it was in the handbook. So just want to emphasize what Gabrielle said about like specificity, like any policy that is passed within prisons, but also within the menstrual health space largely, if there's not specifics surrounding the quality of products, ensuring that things will be unlimited, actually making systems for people to be accountable and for the public to be able to monitor the implementation of policies and be made aware that they are actually being implemented, then things don't actually get carried out. And we've seen this within schools as well, not just within prisons. If there aren't systems to hold people accountable to implement policies, then oftentimes they don't happen. And this also means supporting the people that should be implementing them. So I'm not sure how often with our study, we weren't able to talk to officers and wardens. We were only able to talk to people who engage with officers and wardens, but would be interested to understand what those barriers would be to implementing policies, not to adjust the policies, but to ensure that they're actually going to be carried forward.
Thank you all so much for that. Before we move on to the next question, I wanted to invite any participants in today's or our audience in today's panel discussion to drop any questions you have in the chat, and we'll try to answer them before the conclusion of today's discussion. But I wanted to kind of pass it off to you, Reagan. Where can participants learn more about the policies that are in their state in terms of, legal mandates that may or may not be available, that are addressing, the amount of menstrual products given to incarcerated folks? And what do you think could make access to period products for incarcerated women, even in those states that do have those legislative mandates?
Yeah, so Miriam Vishniak, she's a doctoral student out of Scotland. She created a really, really wonderful website, the Prison Flow Tracker, which she continually updates to ensure that it's accurately reflecting policies that are being introduced and passed and what are in handbooks. She also has the curriculum that Thurman Perry Foundation and Period crafted listed on her website, as well as ways that people can support the Thurman Perry Foundation. So that's a great website to go to stay up to date on policy. And then she also directs people to support efforts that are already directly bringing people period products. As far as improving access, obviously the more sustainable option would be to implement policy that is robust and will be implemented. But also people obviously deserve period products immediately, and they deserved period products decades ago. And so it really is being able to find the grassroots groups in your state and in local areas that are supporting people in prisons and jails, reentry and transitional housing, and making sure that you are supporting their efforts, whether it's monetary. There's so many ways that you can support those organizations, but really important if we pass policy that we work in coalitions and we bring together people that are experts on this issue. So obviously this is an important issue to get behind. I'm sure a lot of people are really passionate about passing this policy, but if you're not doing it with organizations like Thurman Perry, New Hour, and other organizations across the country that know this issue really, really well, then the policy could ultimately just create additional barriers to access and kind of obscure the reality within prisons and jails.
If I can just add, Asia, who you're doing such a great job facilitating, to Reagan's point, often what we see happen, and Gabrielle, you mentioned this, when there is significant national reform, often it is so watered down and it almost impacts almost no one of the population. And one of the things I love about this collective of voices is that we do need national support. For instance, just yesterday, folks were advocating for a national ban against the use of solitary confinement behind bars. And many of my brothers and sisters were there doing that work on the national level. So there's power in creating policy at the national level, but if it's so watered down that it doesn't impact the localities, our local jails, our prisons where women are doing a year or more time, then it really is for nothing. And I think that as a collective, I've seen even over the last 10 years, the growing voices of people who have been impacted by mass incarceration, whether it be their mother, their sister, their uncle, their brother. I often say there are probably more of us with a criminal record now, and at some point, everyone will unfortunately have one because the United States incarcerates more people than any other country in the world. But the menstrual equity piece is something that, to Reagan, your point, we have to continue to push for national change. And once it reaches that fever pitch, it's almost like, well, I can't believe this hasn't happened 20 years ago. People get shocked when they realize that this is not a basic right that it should be.
Thank you so much, Serena, for adding that. I was gonna bring you in, Gabrielle, if you had any insight as well on, what do you think could make access to products easier for incarcerated women? What policy changes would you like to see? What would need to be done?
I've thought about this because I always tell people, like, our Girl Code program at Thurman Perry Foundation shouldn't exist. We shouldn't have to do this work. I look forward to the day when we don't. I would like there to be, well, I will say this. I am very proud of who were our first partners, Orleans Parish Justice Center, Orleans Parish Prison, in the sense that when I am open to anything, when I come to them about anything, they're like, okay, let's do it. And they essentially allow the women to just come and go and get products as they please. We have not heard any complaints from these women. There's a big closet. These women can go as long as they're escorted. There's a huge, big closet. They can go and get their things when they're not on their blocks or in their housing facility. And that's just it, because that's how it should be. And so I want there to be, but it took a while to get to that, because we at TPF have to operate in such a way where we are forever cognizant of what the carceral system is, because it seems so easy now that we do it to be able to donate, but it's not. It is a lot of politics. It is a lot of understanding who we're dealing with, who we're talking to, navigating different administrations, understanding that these people talk to each other. When Serena and I went to the acting commissioner to be able to donate menstrual products in New York, he knew the name of our Secretary of Public Safety, his nickname rather, down here in Louisiana. These people speak to each other. A lot of these people have been in some kind of position of law enforcement for years. Their daddies was sheriffs, they uncles was governors. Like, these people all know each other. And the only way we've been able to spread out our influence is because of the word of other people who have worked with us as far as people in law enforcement. And so we play a very careful, very dangerous game in being able to protect both ourselves and the women that we serve. But what helps more than anything, more than funding, is people knowing about what we do and why we do it. It's why I'm constantly pitching articles to Washington Post, to CBS Morning News, to Essence, to Jezebel, everywhere, constantly buffering both us and the women we serve in a layer of protection, because that has to be there for us to be able to do this work. People have to know that other people care about these women and what happens to them. People have to know that, or they won't act. So if no one cares, if no one is espousing this issue, then nothing will ever change.
Thank you so much for that. I wanted to highlight Kiela's question in the chat. Excuse me if I mispronounced your name. They want to know about menstrual cups or just different like sustainable options when it comes to, they might be more financially sustainable, they're reusable. Can anyone speak to like the possibility of, menstrual being donated or even possibly used in prisons, and what that, would look like, and, some of what, if they would bring up safety restrictions, because I am curious as well, especially as we have more of a push for, sustainable period products and options. What does that look like in the context of the conversation that we're having?
Serena, I'll start, but can you please speak on it from the day-to-day lens? Because here's my thing. This is the number one question that we are asked. We are emailed at least once or twice a week about this. And I've been doing this for like 3 years now, coming on 4. Constantly we are approached by companies, we are approached by donors. I have a bunch of menstrual cups right here near my office that we got sent. It will never happen. We will never donate menstrual cups to incarcerated women for a multitude of reasons. Number one, they don't want them. Because we ask, they don't want them. We've never encountered incarcerated women who want them. 2, I think the question comes from a misunderstanding of what being incarcerated actually is. It is not uncommon for us to be at facilities or to donate to facilities where the women are not allowed to bathe every day. And the process of keeping a menstrual cup clean, especially when I don't know, I think I only know of one facility where they get access to hot water to shower, much less the disinfection process needed for a menstrual cup. Not to mention, I would never bring it to the sheriff, the warden, DOC saying, hey, this method of possible contraband smuggling is what we want to donate to your facility. It would be an automatic no. I know how that conversation would go. And it's also, it's not feasible for incarcerated women because of the ways in which you have to move throughout a facility. So let's say I'm going to visit someone who is incarcerated, or their lawyer is coming to visit them. You do a cavity search going in and coming out. It's just not feasible. It's not the reality of what these women are living. It's just not something we would ever bring to the prisons. And it's also not something I have ever encountered any of these women actually wanting.
And to add to that, while I think it's important to have options and give women choice, I can say, as someone who went on visits myself, and I didn't have access to tampons, but if you do, when you go to visit with an attorney or a person who's coming to see you, you get strip searched, you get cavity searched, and you have to get rid of any tampon that you're wearing, which means you have to spend money to have another tampon available, even if you don't need to actually be changing that tampon at that moment. So it is the system of jails and prisons to find ways to further create criminality and to see women as perpetrators of criminality behind bars. And so even getting tampons was something that at one point was not legal. And the first thing that we hear from law enforcement all the time is, well, they use these options to smuggle contraband in. And the truth is that we know the smuggling that happens, which sometimes may or may not happen, very often happens because of officers who are smuggling it in themselves, not women who are smuggling in and going through a strip search and a cavity search and still getting away with it. So it is a rare occurrence, and one of the things we continue to see is the sort of manipulation of women's reproductive rights and women's access to menstrual products, and to be used as a way to continue to criminalize women. And I know we're not talking about it now, but with Roe v. Wade and everything that's happened, we're seeing more women going to prison and jail because of their choice. And so we're going to see even more of that in the next unfortunate couple of years to come.
We just got another question in the chat from Gabrielle. Gabrielle asked, what is the protocol for incarcerated women to get access to period product donations? And are jails and prisons receptive? Really good question.
I run a tight ship. So we have created, like I said, I am well versed in the history of activism and things of that nature. I am never not unaware of the institutions that I am dealing with and the people that I'm talking to. I am never unaware of that. And I'll preface it by saying that. Number two, we created our own protocol where I went to the facilities and I said, hey, this is what I want to do, but this is how I'm going to do it. We will play by your rules, but this is what I do. And so when we're picking up donations, and it depends, we have different protocols for if it's a jail or if it's a prison, or if it's a transitional housing facility. But across all three of them, we have a certain way that we do things. I videotape everything, to ensure that nothing can ever be accused of us as far as smuggling anything in, because, or God forbid, one of the women getting blamed for something. We operate a very particular way. But typically in the beginning anyway, when we wanted to start donating to prisons and jails, we would approach them and be like, hey, we'd like to do this. If you could give us a letter saying we have your permission, then we would show up, everything already labeled, everything already boxed. And there's a list on our website of products that we donate. And there's a reason why we only donate organic products, one, but two, we're very cognizant of the packaging of these products. Almost all of them are double sealed, certain types of packaging and whatnot, all individually wrapped, to ensure that they can be distributed properly. We get a count from the facilities of how many women are there at any given time. We donate also based on their capacity. Some of these facilities are very old, don't have a ton of space. And they're still contractually obligated to give everything to offer what is supplied through the state. We are just a supplement. But they do prefer our stuff. So the women are given a choice, because if you're only given 2 tampons from the state, it's best for us to be able to come in on the back end and be like, hey. And so we always know when the women are getting their products, because they'll email us via Securus, or they'll write letters. We received a ton of letters from New York. I was very moved when those donations hit. That really spoke to my heart. But the jails and prisons, it really just depends. It depends on if they're receptive or not. I think I mentioned earlier on the call, these days we get approached by the community, like other organizations and whatnot, who hear about what we do and are like, hey, we're hearing these things about the women incarcerated here. And we'll reach out, or typically they'll facilitate an introduction. And sometimes, we won't hear anything back from that organization. I mean, from that facility, they won't want to work with us. And that's fine. Administrations change, sheriffs change, wardens change, things change. And so sometimes it just takes time. But for the most part, yeah, the facilities are pretty receptive. We've only found, I think, 2 that have said no, and we serve 5. So
thank you so much. And as we get ready to close, I wanted to end on more of a positive, hopeful note, and as well as leave our audience with a way to take action, a way to get involved. So I would love to hear from all of our panelists. What encourages you about the future of menstrual equity for incarcerated menstruators? And how can our audience take action to continue to bring this light, light to this issue?
I can jump in there. You can visit New Hour's website. We're on Insta, Twitter, Facebook, wherever, www.newhourli.org. We've impacted over 10,000 women since I founded New Hour with a small board of volunteers 8 years ago. And all of our women come home. So we've been able to provide programs and support to women behind bars in the jails, follow them to the prison if they're going for a state sentence, and follow them home. And in reentry, one of our biggest needs is reproductive health needs, is menstrual products. We are always giving away boxes of tampons and pads and anything that women need coming home. We call it Project Dignity. And so often when you're released from prison, like I was, with a clear plastic bag with all your stuff in it. And so we offer women backpacks and materials. So you can donate money, you can donate support, direct services. We have a toy drive for kids. We have all kinds of ways to get involved. And most importantly, we're so grateful and honored to be supported by Thurman Perry Foundation. Last year during our toy drive, Gabrielle reached out and said, hey, I see you guys are in need. I know you guys need toys. And I was, thank God for people like Gabrielle doing the work out there to hear and see all of us. And especially, it feels especially beautiful to have those of us who've been incarcerated or been impacted, especially Black and Brown women. Myself as a Boricua, I always think about the women that I left behind. And I say that all the time. So if we can pave the way for a better future for all of us, let's get it done. Let's do it together. So honored to be here.
And I'll add, this past legislative session, within the United States, the greatest number of bills were passed and introduced related to menstrual equity. And so it's exciting that conversations like this are happening, and Representative Meng is trying to champion things at the federal level, because given the momentum in the menstrual equity space overall, hopefully with conversations like this, additional policies can be passed and implemented that can directly impact people that are incarcerated.
I would say what encourages me the most is people understanding the intersections of and being awakened to the issue of women's incarceration by understanding the intersections of how all these issues work together. The name of the game for us at TPF right now, more than anything, is awareness and educating people on why you should care about this, because it's not that you should, but it's not just that you should, it's the why. Because I've said before, anything happening to incarcerated people, especially women, is eventually going to be put on to the general public. It's how it always works, how it's always been. And so I just had an article, my very first, come out for Essence Magazine, talking about how our new governor-elect, Jeff Landry, who is currently our attorney general in Louisiana, has been holding the city of New Orleans hostage in terms of funding for their water system while the water crisis is going on, until the sheriff, the DA, the mayor, and city council agree to prosecute women and arrest them for abortions. And so this is not a unique thing. The governor of Arizona has had to strip the prosecutorial discretion for all of the DAs there, so that they cannot start punishing women for abortions. I mean, we are in the fight of a generation, and for the humanity and the dignity of women at all levels. And it has to be all of us, or it's going to be none of us. And so I think what I'm most encouraged about is that there's an audience of people willing to listen. I think if you want to learn more, we have actually launched a Substack at TPF. It's called Bad Girls Bi-Monthly. I'll put the link in the chat. But we essentially write and educate people about, hey, this is what's going on and this is what's happening in the world as it relates to women and girls impacted by incarceration, and what these different things look like and how they can, I mean, whether it's domestic violence, whether it's incarceration, whether it's failure to protect laws, which are used by the family courts to continue to abuse and lock up women. And all these things need to be spoken about, because if we don't educate people, then they won't understand.
Thank you all so much. I just wanted to repeat what you said, Gabrielle, that it's got to be all of us. I hope that this encourages all of our participants listening, those of us who are involved, in the menstrual equity space, that we've got to make sure we're, centering the most marginalized among us, or what we're doing is in vain for sure. So as we close, I wanted to thank everybody for their support. Thank you all for being engaged in the chat. Thank you to our amazing panelists. I'm leaving this conversation feeling very hopeful, feeling inspired. I'm leaving with new knowledge. I feel like I can speak for everyone who has listened in, that we've learned so much from you all. So thank you for your labor, your insight, your knowledge, your work. What you're doing is so necessary and needed. Thank you, Dama, with Period, for your support in today's event. And I just wanted to thank you all for registering and joining us.